Medical costs in the United States are the highest in the world. Our total cost is equivalent to the entire economic output of Germany. Yet, not everyone in the United States is participating. We have 27 million people, nearly 1/10 of our population, that has no medical insurance and thus get very little professional medical care. What is even more disheartening is that for all the money we spend in the USA, we do not have better results. Our life expectancy is lower compared to almost all other advanced countries, but we spend more money per person than anyone else. Most advanced countries seem to have figured out a way to provide health care to nearly all their citizens at much lower cost, and most are using a single-payer health system. But just because it works for other countries, does it mean that it would work for us too? Would it really cost less or more? Would it cover more people? Would it really be better for us? And if it were, who would pay for it? Let's dissect this and answer this complex problem in the next 5 minutes. If you guys enjoy this channel, be sure to subscribe. And if you like this video, then please like and share. It costs you nothing and helps me create more fascinating videos for your pleasure, and I hope you give a bleep. Let's be clear. Single-payer healthcare does not mean that it is a free healthcare, and it is not, as you might hear from detractors, socialized medicine, where the federal government owns all medical facilities and employs healthcare providers. This is not under discussion for the United States in any credible proposal. So what is single-payer healthcare? Let's look at the most detailed plan that has been introduced and the one that everyone is debating. And that's the plan developed by a team led by Senator Bernie Sanders. It would be a national healthcare plan that covers everybody, whether you are employed or unemployed, rich or poor, sick or healthy, black or white, 1 year old or 101 years old, and it would not matter if you had a pre-existing condition because absolutely every citizen would be covered. Basic vision, dental, and hearing expenses would also be covered. There would be little to no out-of-pocket costs for medical services by Americans. This plan would eliminate nearly all private insurers, but private plans by insurers would still be offered for people who wanted more coverage and for those who could afford it. This would mean that Medicare, Medicaid, Obamacare, employer-sponsored plans would be eliminated, so your medical costs would not be managed by a huge industrial and government complex of insurers, state agencies, employers, and charities, but by a single national agency that oversaw the medical needs of all the people in the United States. First, let's get one fact out of the way. The government already pays for about half of all medical costs for Americans, in the form of Medicare for people over 65, Medicaid for low-income families, and veterans benefits for those who have served our country. Another fact is that this would not be like Medicare, because there would be no out-of-pocket costs and because Medicare does charge premiums and deductibles and doesn't cover vision, dental, or hearing. But even though this is not like Medicare, it is still referred to as Medicare For All, or M4A. So I will use single-payer and M4A interchangeably. And who would pay for this? We would, in the form of taxes. And how much would this cost? Well, let's look at what it costs right now. The Department of Health and Human Services estimates that for 2018, the total medical cost of the United States is about $3.5 trillion, and this is expected to rise every year. The total cost over 10 years in our current system is projected to be $45 trillion by the Department of Health. This is how this cost is currently funded. It is funded roughly 30% by out-of-pocket expenses, 45% by federal and state governments or taxes, and 20% by employers. A recent paper by the Mercatus Institute, a think tank that advocates for market-based approaches, estimated in 2018 that a single-payer program would shift about $33 trillion over 10 years to the U.S. federal government. This $33 trillion number matches closely with the number estimated by another think tank called the Urban Institute, which advocates for government-funded healthcare. So the numbers are probably realistic, since both of these institutions agree. Politicians have taken this $33 trillion number and said that it would be a single-payer system cost, but it is not accurate to say this because this money is not an increase, but rather a shift from individuals and employers to the federal government. So it is not an additional cost, just a shift in cost. The $33 trillion would replace the out-of-pocket costs for individuals and employers and replace them with taxes instead. Federal taxes would have to go up, but insurance premiums, federal Medicare tax, and state and local Medicaid taxes would go away. The Mercatus paper actually found that overall total healthcare costs would go down over 10 years. But we have to be careful with the lower cost projections because $33 trillion may be underestimating the cost. Why? Because there are some big assumptions in cost savings over 10 years. The biggest assumption in Bernie Sanders' plan is that $5.5 trillion would be saved by paying doctors and hospitals at Medicare rates, which is lower than what they currently get paid from insurance companies, but higher than Medicaid rates. These savings assumptions may not be realistic because we can't be certain that doctors and hospitals would accept lower Medicare level payments for everything. The other factor that needs to be taken into account is that there's likely to be an increase in medical demand because 27 million more people that currently do not have medical insurance would now be covered. In addition, people may want to visit doctors more because the plan may make it easier and less costly to visit doctors. So what's the bottom line? The bottom line numbers, taking these factors into account, is the following over 5 years if the plan is implemented in 2022. So from 2022 to 2026, if we do nothing under the current plan, the cost will be $5.1 trillion per year. Under the single-payer plan, assuming it reduces fees, average cost would be $4.9 trillion per year. Under single-payer, assuming no fee reductions and increased demand, the average would be $5.3 trillion per year. And remember, these are estimates only. No one knows for sure. If we take the average between the reduced fee scenario and the no fee reduction scenario, ironically, the number is $5.1 trillion, almost exactly the same as the do nothing option, except, and this is the big difference, that under the single payer plan at $5.1 trillion, there would be 30 million more people covered, or almost 10% of the population covered. The other question we have to ask ourselves, do we really have a do nothing option? Our current system has some serious flaws. Our medical cost per person is much higher than advanced countries. In addition, these costs are rising at about twice the rate of inflation and much higher than other advanced countries. But our results are not better. American citizens are not healthier nor live longer than people in other advanced countries. 27 million Americans with zero medical coverage. That's almost 10% of our citizens. There are huge resources that are being dedicated to the medical insurance industry currently, including 470,000 people employed that are basically pushing paper. There are specialized billers trying to figure out what insurance companies will and will not cover. There's litigation costs, there's employer resource costs, there's state resource costs for Medicare and Medicaid, and there are yearly national tax battles. There's inefficient delivery because of inconsistent coverages, inconsistent costs for the same procedure from state to state, county to county, and even hospital to hospital. There's confusion and yearly changes to insurance plans. The current system is a mess and may be unsustainable. But many questions remain about a national healthcare system. Would the demand be so high that you couldn't get in to see a doctor, as is the case in some countries? Would people need to purchase more insurance on their own for better or more care? Whose taxes would be raised to pay for this? Would everyone pay the same, or would higher income families pay a higher tax? Insurance companies employ 470,000 people. Could they find other jobs? The question we have to ask ourselves is, what are we willing to sacrifice to sustain our medical health over the long term? And how important is it for us to make sure that everyone has access to medical care? How much are we willing to pay for it? Should everyone pay the same taxes? If not, who pays more? And finally, who do you trust more with your health care? Profit-motivated insurance companies or the bureaucracy-driven federal government?